The government plans to further relax its rules for hiring foreign caregivers. As early as September, it will exempt 3 groups of people aged 80 and up from passing a test based on the Barthel Index, which measures the ability to perform everyday tasks. This policy comes after waivers were extended last October to people suffering from dementia, those with breathing or swallowing difficulties, and those who have received long-term care for at least 6 months.
With a declining birth rate and an aging population, more people are set to grow old without family support. Yet hiring a caregiver can be challenging. In most cases, it's contingent on passing a Barthel Index assessment.
The
first time it was more difficult because my mother was under 80 years old. They should have relaxed the requirements earlier, and this policy should enter effect as soon as possible. If a caregiver can't be found, we're forced to sacrifice our careers to look after our elders. This comes at a huge social cost.
Ministry of Labor says it will further ease requirements for hiring a foreign caregiver. It will exempt 3 groups of people from a Barthel Index assessment: those at least 80 years old and who have a long history of medical conditions, who have disabilities due to irreversible medical conditions, or who have disabilities and a history of medical visits in remote areas. The exemption will enter effect as early as September, benefiting 55,000 people.
We will continue to optimize the evaluation process for those who need professional evaluation. Anyone who needs it, regardless of age, can apply for a home evaluation. This also applies to people living in remote areas and people who can't go to a medical center due to severe conditions.
The Health Ministry endorsed the change. The Barthel Index requirement has long been criticized for being too strict. Based on the Barthel scale, a higher score reflects a higher degree of independence. To qualify for full-day care, people under 80 years old can score no more than 35 points or get a doctor's authorization if they exceed it. People aged 80 and up must hit the Barthel standard for severe dependency. As for people aged 85 and up, they must meet the standard for a mild dependency.
People with physical disabilities or conditions like Parkinson's or other degenerative motor diseases can apply if the individual is considered to have a severe disability. We doctors conduct a detailed assessment of their condition and their physical state. If we feel that the individual meets the criteria, in principle, we follow the established process to handle their case. Caring for people with severe conditions requires labor, and not just one person. It's not something that can be done by one person alone. So what can we do? If we are still not tackling the core issues, how can families in more difficult positions benefit from the loosening of rules?
With an aging population, elder care and caregiver issues are demanding urgent government action.